the Wellness Hour. An in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You're watching the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, hot topic, new breakthroughs in skincare. We have two estheticians on the program today, but first, we're talking to probably one of the best makeup artists in the desert, and it's Vanessa. Vanessa, welcome to the program.
Thank you, Randy.
Now, I told you we've done about 950 of these programs that air throughout the United States and Canada, and I said, the makeup you did off camera that I saw was the best I've ever seen.
Wow, thanks.
So good job, good job. Now, today we're talking about skincare, but you also work inside the Cosmetic Surgery Institute of Palm Desert.
Right.
What is your role there?
I feel like I'm sort of like the icing on the cake. Okay. I'm the last person they see, whether they've had surgery, fillers, Botox, or whether they're getting their skin treatments. I teach women how to camouflage their flaws and discover their beauty in a way that looks really natural, and also to simplify their routine so that they can take that look with them every day and be able to do it for themselves.
Do women need a lot of help when it comes to makeup, by the way?
I think that most people, even the most beautiful people that you see, do require some camouflaging and some highlighting. I think that it's a mystery.
They need coaching? Do they need coaching?
Yes, absolutely. When I'm dealing with the customer, most of the time they're either not wearing any makeup, and it's because they don't know how to do it, or they think it's going to take forever, or they're going to look heavy and made up, and that doesn't fit their lifestyle. Living in the desert, I've got a more mature clientele. Okay. Working with the seasonal client, I work in Saks Avenue.
So now at the Cosmetic Surgery Institute of Palm Desert, so people can have their makeup done there. If they're going to an event, they go right into the center after their Botox.
Sure.
Then you do their makeup.
Yes, and I also, my specialty is makeup lessons. I love teaching women. Yes, I love teaching women how they can quickly achieve improvement in a very natural way for themselves on a daily basis. And then, of course, if they have special occasions, they can come to me and we can do that special makeup. And even if I'm doing that special makeup, I still want to maintain their natural beauty and make sure they don't cover up their natural beauty, but that I'm just bringing it forward.
What are the biggest mistakes you see that women make with their makeup?
Well, I think that in makeup, a lot of women will maybe sort of get stuck doing their makeup the way they were shown how to do it maybe 15 years ago, and their face has changed.
Good point.
And it's time to update their makeup. And I also think that a lot of women are very heavy-handed with their makeup. I think that less is more.
You're not just doing their makeup, you're telling them tips that they can take with them.
Well, exactly. And
interesting.
A lot of times when I'm doing I've had the situation where someone sits in my chair and they're like, I hate makeup. Don't put any makeup on me, I hate it. And I'm like, why do you hate it? And maybe they've had their makeup done in the past and they didn't feel like themselves and they washed it off immediately. And so it's my job to find them a makeup.
You get them to love to wear makeup again?
Well, I give them something that is in their comfort level. Something that they're going to look in the mirror and say, yes, this is how I want to see myself. I feel like my makeup artist listened to what I wanted and not just did what she wanted. Then it's not about me when I'm working with the client. It's about them, and it's about getting them to feel good on a daily basis.
And it makes their skin look really good.
It makes it, and just highlighting, and you would be amazed that a lot of people think, they look at me and they think, well, your skin is perfect, and you probably don't even need makeup. And I'm like, I'm wearing concealer, I'm wearing powder, I'm wearing bronzer, I'm wearing blush, I'm wearing
I'm wearing all those
tons of products. But the trick is getting it to look very natural.
Okay.
People want to look natural. They don't want to look artificial. And that's what I love about CSI is all of us as a team really, we're after an inner beauty, a natural look. We want our clients to look fresh. We don't want them to look artificial. We want them to look like them, only younger, better.
Good.
All those
I want to thank you for coming on the show. Cosmetic Surgery Institute. You could ask for Vanessa. You'll do it for their wedding, for the event.
Absolutely.
You'll do makeup for any of those occasions.
Absolutely.
Even at their house.
Yes.
All right. I want to thank you for coming on the show. We'll be right back with skincare with the two busiest estheticians in the desert. We'll be right back. You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know about having younger looking skin. With us, we have the top two experts in the desert on this topic. They are the busiest estheticians in all of the desert. We have Marissa and Adrian. Welcome to the program.
Thank you.
Okay, so you both work at probably the busiest surgery center, plastic surgery center in the desert with Dr. Mo Zachary and the new doctor. What is his name?
Dr. Habash.
Okay, great guy too.
Yes,
as well.
wonderful guy.
And now, before we get into today's topic, tell us a little bit about your center. Why don't you tell me a little bit about, we had you on the program about 4 years ago, kind of the different things you do there.
Well, we are truly like a one-stop shop.
Okay.
We do everything there. Skincare, fillers, Botox, lasers, permanent makeup artistry, and of course surgery. That's what makes us unique. You can literally come in there and do everything.
Now, you both have different areas. You're both estheticians. And you guys said, I mean, are you the busiest, you think, in the desert when it comes to estheticians?
I believe. I mean, we actually have a waiting list for
Really?
people who are
Cancellation
waiting
list.
to come in and see us that can't get in for a couple months. So
Is that right?
it's wonderful.
So
yeah.
how often do people, when you're on that list, I mean, how often do people get their face done by you? Once a month?
Once a month.
Once a month.
On average.
We have some clients that actually come in every 2 weeks, but general speaking, 4 to 6 weeks, I think.
You guys have a kind of a high-end clientele, but also the average everyday person as
You
well.
know what? It's
All different ages.
working people that snowbirds. I mean, it's a variety. Teenagers,
I was going to say teenagers. A lot more teenagers
Really,
nowadays.
more and
that
more
need-
teens are coming in for acne and things like
Acne.
that. So Marissa, with you, I had you on the show several years ago, but what's changed? And I always assume everybody knows a little bit about your background and your training. So tell us, let's start there about you.
Okay, well, my husband and I moved here about 5 years ago. We love the desert, came out here to be closer to family, and I've been an esthetician for 8 years now and been over at Cosmetic Surgery Institute for 5. A lot has changed. I actually came from working in a spa, and I can't tell you how much I love working for a doctor. What I mean by that is I see changes in my client's skin. You truly will see a
Really?
change. When you come to see us,
Because I
promise
said, can you really make a big difference?
You can. I promise you, one treatment, you come in, your skin will feel different, look different.
But once a month, though. What about men? Are men coming in?
Oh, yeah.
Really?
More and more
I have
men.
more men.
Real men?
We have more men now. Yeah.
Real men. Yeah, more and more men are coming in. They want to take care of their skin, too.
Absolutely. Or the wives,
The wives get them in, and then they get
give them
hooked.
the jump start, and then
Really?
they're hooked.
And then they
It's
get
over.
Botox, and then they start getting mani-pedis.
Oh,
and then
yeah. And we actually have some clients' wives that come in and they go, okay, there's something wrong. My husband's actually coming in here more now than I do. So men are
Okay.
definitely, more interested.
And so the desert, because it's dry and things like that. What special things that you have for them?
We actually have this new treatment. It's an oxygen facial.
Yeah, tell me about that. Let's start there.
Basically, what it is we kind of came about it through hearing about it, seeing a lot of celebrities are doing it. It's a concentrated serum that goes into the skin. It's hyaluronic acid, peptides, and antioxidants. And what makes it unique is it goes into the skin cells. It's actually pushed through like a pressure, pushes the oxygen into the skin along with the serums. And you
Sounds
really
painful. No, I'm kidding.
No, not at all.
Not at all.
It
It
is
feels
so
really good.
You sleep during the
very
treatment. It's an
relaxing.
hour treatment.
And the results are amazing.
Amazing.
Lighter, brighter, more plump, smoother. The pore size is less visible, and instantly.
Are there women that come in that say, I've been doing this for, going to estheticians and this oxygen treatment? I mean, is this your most popular treatment?
Well, it's relatively new.
It's new.
It's new.
Our most popular, I think, would be the dermaplaning.
Absolutely.
We get people, again, this is a treatment that can't be done in a spa, only under a doctor, and there's not that many estheticians that do it. It's very
Okay.
specialized.
Now, we said at the top of the show you're the busiest, and it's tough for people to come on the show and brag about themselves. But why is it, do you think, you're the busiest?
I think it's a variety of things. I think it's how much we do in 1 hour.
Absolutely.
Okay.
Our treatment, we work on not just, when you go to a lot of places, it's just kind of the face. We work face, neck, chest, arms,
Eyebrows.
hands.
Anything that we can fit in 1 hour, we will do.
It's jam-packed in that 1 hour.
It is.
Patient to patient.
Do people tell you? I mean, do people tell you, you guys do a lot more things.
Oh,
in this world.
absolutely.
Yeah, absolutely.
Really? You hear that all the time?
And
I
our
think
price is very good too.
It's very good.
Lower than Costco? That's a joke. I'm joking. We're trying to trip you up a little bit. Yeah, they have estheticians there. Okay, so this oxygen facial. Okay, do you advertise? How do people hear about it?
We just started offering it. We're doing a little bit of advertising, but it's really just word of mouth.
Describe it to me, by the way. Describe it. Is it a machine? What is it?
It's a wand. It's a pressure, almost like if anybody's familiar with airbrushing their fingernails or getting a French manicure. It's the same type of wand that they use, and it has a pressurized top to it. And what we do is we infuse hyaluronic acid onto the face, which is your body's natural moisture magnet.
Okay.
The skin is vibrant, flawless,
glowing. And it's perfect for a wedding or if you have a special event.
Do you do this oxygen treatment to each other?
Yes.
We do, yeah.
How often do you get it?
Oh, I'd love to do it like once a week, but
we don't have the time.
We don't really have the time. But you could do it once a week, and you can actually do it in a series. Do once every, for 6 weeks, and then go on like a maintenance program. And we do this with our skin treatments.
Right. You could piggyback them.
So with this oxygen infusion treatment, how soon do they see results?
Instant.
Immediately.
Okay.
Right then and there.
You'll leave. Your skin looks glowing, plump. We can actually see the skin somewhat lift from the hyaluronic. I know it sounds, and no,
it does.
It's not that you're going to leave and you're going to look like you've had a facelift, but you will notice that the skin's going to be hydrated and plump, and you'll feel really good.
Do people use this for events, like prior to an event or a weekend?
Yeah, definitely.
Weddings, parties, high school reunions.
Yeah, we're really busy right now, like especially during the holiday time. It's great.
Christmas parties.
And there's no downtime. You literally can do it a few hours before, put your makeup directly over that. And that combined with the dermaplaning is like a flawless look.
So when they call, what do they ask for? Oxygen what?
Infusion.
Oxygen infusion.
Okay, good. And you both do it?
Yes.
Who does it better?
We both do it. Good.
Both do it good. Okay, so what else? What other technology do you have there? Or what other things are you doing for the face?
The melanage, yeah.
Yeah, what is this melanage? What is this? We'll start with you.
Okay. Basically, what the melanage is it's for hyperpigmentation, so brown spots, or melasma. Melasma is a big thing that a lot of women deal with after pregnancy or just from being out in the sun. It's kind of thick patches of brown pigment.
Well, I hear there's not much you could do, though, for melasma.
Well, that's where we came across this, right?
All right.
It used to be that way. Not anymore.
Interesting. So tell me about this. Okay, so they have these dark spots. And we're not talking about IPL or laser here.
Right.
You're saying it's a topical?
It's a topical. It's a peel.
It's a peel.
You peel and heal.
Peel and heal.
Peel and heal the skin. And what's great about it and what makes it so unique is you can use it on a whole span of skin types.
Okay.
A lot of times with the laser, you can't perform the treatment on darker skin types because of the melanin production. You'll actually have even more hyperpigmentation. And with the melanage, it's safe to do on fits 4 or 5.
Any skin type from, very fair skin to darker skin. It's wonderful for all skin types, and also it doesn't hurt. That's the big thing. It does not hurt.
Doesn't hurt. Some of the procedures hurt?
Well, peel's uncomfortable. Can sometimes peel, not hurt. I shouldn't use that word, but
maybe a little sting to it.
Is there downtime on this?
There is.
About 3 to 4 days of peeling, redness.
Really?
It's minimally invasive.
But it's nothing that you can actually.
For melasma.
It has a name like melasma in the, and these are the brown spots that don't go away very well with the IPL treatments. Is that correct?
Right.
Okay.
So by doing this treatment and then following it with regular maintenance of skin treatments, you really will see a difference.
So, because to me it seems like most people get, go to estheticians. I guess women do. But how many? I mean, what is the percentage? Like half the women do, 30% don't?
Probably about 30%. A lot more women can come in and get routine facials once a month. It's like getting your nails done.
Okay, what are the biggest mistakes women make, as you see it, with their skin in the desert? Like what are mistakes they make? Like you hear them say, well, this is what I do, I use oil of Olay or whatever. What are some of the mistakes they do for their skin? Anything pop in your head?
I don't know if it's mistakes. I just think a lot of times women, because we're so consumed with what's at the, grocery stores or what's on TV, what's in the magazines, is you don't really know what to use. So when you come to see us, we can actually look at your skin and say, no, it's okay if you want to use this oil of Olay.
Right.
That's fine. But maybe use this with it.
A little more hydration.
Right. So we are actually kind of counseling you and helping you figure out what the best thing is for your skin.
Because you also offer products there.
Right.
Tell me about the products. Tell me about your product line there.
We have our own product line, that Cosmetic Surgery
Private
Institute.
label.
Private label.
Is Dr. Zachary's face on it?
No.
No.
Maybe he'd want it to be.
Good idea.
You never know.
With that open shirt. The open shirt look he used on one of my shirts.
We have our logo on
We get a lot of press about that.
Yeah.
That's right. Dr. Zachary, and by the way, if you're just tuning in now, we're talking about, we have the two busiest estheticians in the desert. They both work at the Cosmetic Surgery Institute of Palm Desert. And we're talking about skincare, what's new, this new oxygen infusion. Is that right?
Yes.
You guys say, I could use that, right? Everybody can use that.
Oh, everyone can use it.
And Randy, what you would love about it too is it has a toxylene in it, which is almost like a topical Botox, which helps with expressions on the face.
Okay, good. So now the people that go in for facelifts and things like that by Dr. Zachary, do they automatically go over to you? Are you part of the maintenance plan with these people?
Yes. Yeah, we actually see them, especially if they do any kind of laser resurfacing, they come to see us for oxygen treatments.
They get 3 treatments.
3 treatments of oxygen, which actually helps with the healing.
Okay.
And then they also come in for a post-op skin treatment.
What about sunblock? How important is that? I mean, everybody knows about sunblock. There's so many different types of sunblock.
You want an anti-wrinkle cream? Use sunblock. That's that's the best way to explain it. It's prevention.
But every day. But the problem is greasy. I mean, wear it under the makeup.
There's oil-free. There's so many
tons of different types of sunblocks.
And we have a lot of different ones.
What's your favorite?
Oil-free with moisturizer.
I personally we have our private label one, the SPF 45. I love.
Okay.
It's hydrating. It has antioxidants. It's a moisturizer as well. So wearing sunscreen, it's never too late to start wearing sunscreen. I have a lot of women that, are in their 60s. Oh, I don't need to wear it anymore.
Done.
No, keep using it. Actually, I think 90% of our aging is caused from the sun. So you can, if you're, young, you can start wearing sunscreen.
Especially being out here in the desert.
Yeah.
It's the sun.
Okay, what about parents and their kids with acne in high school? Because, self-esteem is hit pretty hard when you have these kind of things. What do you say to those parents or these, 18-year-old people? Maybe they think it's too expensive, because I know your prices. It's not a lot of money.
Well, you know what I think is great is coming at an early age, learning about the skin, learning the pH, how it works, what causes acne. Just teaching them before and the prevention, because once you start hitting 15, 16, 17, football players in high school, with their helmets, they get the acne on the jawline.
Yeah.
We see a lot of that.
But you don't see a lot of football players coming in.
Oh, yes, we do.
Do you guys have a rear entrance for these poor guys?
Again, the moms that bring them in.
Really?
I know.
So you have high school football players coming in to see estheticians.
Oh, yeah.
That's a sign of the end times, by the way, I think. Okay.
But they love, and they love the treatments too. And we actually have an acne kit, which helps, and it's fairly inexpensive. And our treatments actually for teenagers is a half an hour.
So adult acne. Adult acne?
Oh, we see a lot of adult acne.
Would you like to see more of it? Would you like to see more of it, though? I mean, are there a lot of people that do nothing?
Absolutely.
Oh, sure. I mean, all the time they start using a Proactive, which is fine, but again, coming in for to see us.
That exfoliation. You only can go so far with glycolic acid or salicylic at a 4%. We have peels that are 20, 30, 40, 50% in the office that you would do. And it's just a big difference.
How often do you two do peels? Because your skin, I mean, it's unbelievable. How often?
Well, I mean, it depends on kind of downtime, how much we can, if we have that time to peel. But I'm always doing something on my skin,
A glycolic. I do that
light
once
acids.
a week.
And so when you come in to see us, you're not going to have to leave always peeling. No, not at all.
There's lunchtime peels.
That's something that you can, a more aggressive peel where you actually get peeling in the skin, you can do once every 3 months.
Right.
We're going to take a quick break. We come back, more about this treatment for spots on the face. You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. We're talking about skincare. We'll be right back. You're watching the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. We are here with the estheticians from the Cosmetic Surgery Institute of Palm Desert. We have Marissa and Adrian. Okay, it was very funny actually at the break. I said, are there any things you're doing that other people aren't doing? And then you guys start talking amongst yourself about dry ice and this and that. And then Marissa says, I don't know, do we really want to tell them our secrets?
I don't want to reveal all my secrets.
Because you two are the busiest. I mean, you have a waiting list. People are fighting to get in, in to see you. So tell me some of the things, some of the little secrets. I guess, what are they? I mean, you mentioned dry ice. You use dry ice.
We do. Well, it's actually liquid nitrogen.
Okay.
And after the exfoliation process, after the dermal planing, we use liquid nitrogen and we smooth it over the surface of the skin. It helps with pore size. It helps with bacteria on the skin. It's an antiseptic. And it also helps exfoliate the skin a little more, really tightens and brightens the skin. And that's just really great after any type of exfoliation.
Now, I know you don't want to give away all your secrets, but do you think that you do things a lot differently than most estheticians do? The way maybe the timeline of what happens first, second, third, fourth. I mean, do you? Do you feel that way?
I think so. I just, like Adrian touched on, I just think we do so much more. Every time I have a client who, let's say, lives during the summer somewhere else, and when she comes back, she goes, God, you do so much more than my other esthetician.
Really?
It's so much different, yeah.
She goes, oh, you're so different. You're, and I know you hear this all the time. You're just mixing things and cocktailing things together.
Chemist.
Truly. And we are, and that's what we do, and we love what we do. So,
and our product line enables us to do so too, which I love.
Yeah.
That's
At the end of the day, are you exhausted?
Yes.
Oh, yeah. It's hard work.
Truly.
So you're not even able to go out afterwards?
No. We see 8 patients a day.
Really?
Sometimes, yeah.
So 8 a day.
Sometimes 9.
Now, is it hard work on your hands? I mean, can you spot, by the way, and I'm off topic again, but when you see somebody's face, could you know the treatment in your head that you're going to use for them? Like in your mind?
You have kind of an idea.
Absolutely. And doing it so long, too, you get used to different skin types and what would work and what doesn't work.
Okay, but the hottest one right now, we talked about this oxygen infusion, okay, which reduces, creates a bit of a inflammatory effect, okay, and smooths out the wrinkles, okay, and great for weekends or going out or events, and then this new thing that gets rid of spots. And it's a topical, melanage.
It's a topical. It's a peel.
It's a peel.
And what's the downtime again?
Like 3 to 4 days.
3 to 4 days of peeling. And a little bit of redness, and then a couple weeks, and
then you come in for a post-op visit, and we do any touch-ups, on areas. And
okay, but why not just go get zapped off with an IPL or something? That's my question.
It's always good to. While IPL is great, it's always great to have other options available. Maybe somebody doesn't like the feel of the IPL. They rather have.
So the IPL though is probably more expensive for a series of IPLs to do the same thing.
To do a series.
Yes, definitely.
And what's great about the melanage is you only need, it's one treatment, and you do it once a year.
Once a year, you can do it, yeah.
So final message. We're out of time. Somebody's watching this, maybe they used to go to an esthetician, maybe because of the economy or whatever, they just stopped going to an esthetician. What do you tell them about their skin? And we'll start with you. To get them back in there.
I would just say, come on in, because we have so many new treatments, all different price ranges. We truly can help your skin. You will leave with a glow, and your skin will feel softer and smoother. I can promise that.
Is that right? Okay, Adrian, and you?
It's just, it's so much different now. The treatments that we're able to do, it's just so much better.
So especially acne, because you like the acne patient.
I love the acne patients just because it hits home with me.
You had it pretty bad?
Oh, I had grade 4 cystic acne. You couldn't see my skin.
Really?
I had the pot marks and the cysts and red and purple. It was really bad. I wouldn't leave the house without a layer of concealer. So
you'd like to see more of those?
I would love to see more of those patients. Just come in, talk to me, tell me what you're doing, what your home, regimen is, and we can work out something.
Okay, great. Great glowing skin. More men need to get in there to do this.
Women, yeah.
Women.
All ages, too,
But you're still taking on new patients, even though that, you've got a waiting list.
Yeah, we still take on.
We still have new patients.
But once you're in, and you have some high-end celebrity clients as well?
We do. We do have some celebrity, local, maybe celebrities.
Absolutely.
That are coming in. Do you have people that travel to see you?
Oh, yeah.
Definitely from LA,
a lot of snowbirds.
Orange County.
People don't like to switch their estheticians. Is that true?
No, they like to stay.
Yeah.
Well, and you develop, a personal relationship with them.
When should somebody make a
your
change?
friend.
Okay, what about people that are watching this, that are hearing about all you do in 1 hour? When should somebody change estheticians? Give us a tip. Not generally change to you. Just
maybe when you feel like you're sort of
getting the same
thing over and over again.
Your skin needs to
if you feel like
different treatments. I mean, if you come in once a month, which is great, that's good, but you have to have a different treatment every month. That's why we like to trade off. We'll do an enzyme or we'll do a peel. Each month we'll do something different for your skin. Again, tailoring it to your own specific needs.
Right.
But at the same time, that's one of the things, and we have a huge product line that we use.
Okay, good.
That's one of the things that I love about this office.
All right, well, nice meeting you today, Marissa.
Nice
always a
meeting you
pleasure having
you
on the show, and we'll have to have you back again.
Thank you.
Thank you both.
Randy.
You've been watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again online, you can visit our website at wellnesshour.com and just put in skincare or estheticians, or of course the Cosmetic Surgery Institute of Palm Desert. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.